Gentleman yields back. Now recognize the gentlelady from Massachusetts, Ms. Trahan.
Thank you. Thank you to our chairs and our ranking members for holding a hearing on the federal response to COVID-19. I want to thank our witnesses today for your testimony, for your patience, certainly for your leadership as we navigated the most deadly pandemic of our generation. The U.S. has made tremendous progress in our fight against COVID-19. As many of my colleagues have already said today, the Biden administration stood up the largest free vaccination program in U.S. history, delivered hundreds of millions of free at-home tests to households, and passed the historic American Rescue Plan, which put money in the pockets of financially strained Americans and enabled schools to reopen safely for our kids. COVID has required an all-of-government response that tested the federal government's public health system capacity, including testing and vaccine development, supply chain capabilities, treatment and medical responses, and workforce readiness. It is critically important now, more than ever, to take our lessons learned from COVID to better equip our preparedness and response systems so that we're never caught flat-footed again. For this reason, I will be introducing a bill in the coming weeks that funds a Disease X medical countermeasures program at BARDA for unknown viral threats with pandemic potential. Current funding constraints at BARDA only allow the agency to go so far, with much of BARDA's MCM development work focused on a defined list of chemical, biological, radiological, and nuclear threat agents, as well as influenza. We may not be prepared to develop and manufacture at scale future drugs and vaccine against unknown viral threats that can lead to a devastating pandemic. The Disease X Act will help BARDA to fully focus on their full list of priorities, including increased focus on emerging infectious diseases. That said, BARDA played a critical role in our response to COVID. With a decade of investments in platform technologies under flexible agreements, BARDA was able to pivot to develop COVID-19 MCMs at a rapid pace. Dr. Califf, as you know, Congress passed many provisions from the Prevent Pandemics Act as part of the 2023 Omnibus Funding Bill that was just signed into law. One of these provisions creates a platform technology designation program at FDA to support the development and review of new treatments and countermeasures that use adaptable technologies that can be used in more than one drug or biological product for novel public health threats. We saw how powerful the mRNA platform was for the COVID-19 vaccine, and now other applications of this platform are being explored. So Dr. Califf, how will this new regulatory designation for platform technologies potentially lead to faster development of vaccines and therapeutics for currently unknown emerging infectious diseases in the future, and how does FDA plan to implement this new designation?
Well, mRNA is the example, as Dr. Tabak already stated. When you've got a platform that can be used for multiple different therapeutics, it's a wonderful thing. But it doesn't happen overnight. So if you wait until you're in a crisis, you can't then develop the platform. This happens over years to decades. So working with our partners at NIH, BARDA, ARPA-H, I wouldn't be surprised if it has a critical role to play here. We want this to happen so that when there is a need, the platform is available and multiple therapeutics can be developed.
Thank you. And as mentioned previously, provisions from the Prevent Pandemics Act were recently signed into law. While I'm pleased many of these provisions have been enacted, this cannot be the end of our work to strengthen our preparedness and our response infrastructure. So Dr. Walensky, what are some of the capabilities to detect and monitor emerging infectious diseases at CDC included in the Prevent Pandemics Act, and what additional authorities and resources are needed to prevent and respond to future pandemics?
Thank you. So through Prevent, we were able to receive OTA, other transaction authority, but we were unable to receive the data authorities that we need, the workforce authorities that we need. From a workforce standpoint, our ability to rapidly respond, if we are going to be a response-based agency, which we are working, but we've never had to at this size, scale, and scope. If we're going to be able to to respond at this size, scale, and scope as was required over these last 3 years, we need to have the authorities that other response-based agencies do, workforce, hiring authorities, danger pay, overtime, as well as our data authorities. It took us 6 months to receive data use agreements from 100 different jurisdictions early in the pandemic in order to be able to see the data. Similarly, through the MPOX challenges over the summer, we had the same challenges in not having to be able to see the data. If you can't see the data, you can't act on the data. And that is true at CDC, but also back at the local level. We'd like to give those data back to the local level so they can respond as well. Thank you.
Great. Thank you so much.